Good day, everyone. My name is Dr. Tiwad. Welcome to another episode of Seco Direct. And today we're going to talk about prostatitis. What is it? What to look out for? What are the symptoms to look out for? Who does it affect? What causes it? What are the complications that can come about from this condition? We also talk about the investigations that we should do and the treatment that we would go through when we are dealing with prostatitis. This is an informative episode, and we hope that you get the information that you need to get from this. Thank you very much, and let's get on with the episode. So, what is prostatitis? It's in the name. Prostate, that's the first part. It's an organ that is underneath the bladder. And when it is affected or inflamed, we have the second part, the itis. So, in combination, prostatitis is the inflammation of the prostate gland. Prostatitis can be caused by different factors. Now, what can inflame the prostate gland? Infection. What type of infections? Scientists have brought about four things that can affect the prostate gland, and they are chronic prostatitis, which is chronic pelvic pain syndrome, acute bacterial prostatitis, chronic bacterial prostatitis, and asymptomatic inflammatory prostatitis. When we are talking about this condition, we have to look out for the symptoms. Now, the symptoms of prostatitis have a range of symptoms, especially because it's an inflammatory process. And when it's an inflammatory process, it means there's an infection. So, infective and inflammatory symptoms will come about. For that is chronic pelvic pain syndrome, the main symptoms here include pain and discomfort lasting 3 or more months. That's where we get the chronic part. And we have this pain occurring between the scrotum and the anus, in the central lower abdomen, on the penis, the scrotum itself, and the lower back. You would also notice pain during ejaculation, and this pain will spread out along the pelvic area when it comes to chronic pelvic pain syndrome. You would also feel pain in the urethra or pain after urination, pain in the penis during or after urination, and then it can also bring out lower urinary tract symptoms such as the frequency of urination would be more, at least 8 or more times a day, and also you'll be feeling the urge to go and urinate a lot of the time. Then, lastly, we would have a weak or interrupted urine stream. Now, this is chronic pelvic pain syndrome, so most of the symptoms are concerned with pain. Moving on to acute bacterial prostatitis, the symptoms of this condition come on suddenly, and this requires immediate care because the symptoms of acute bacterial prostatitis are very, very sudden and are very, very important to note. You would have fever and chills combined with lower urinary tract symptoms like urge to urinate, increased urinating frequency. You would have a burning feeling when you're urinating around your genital area, your groin, your lower abdomen. You might have symptoms that may appear like sexually transmitted infections, but in this condition, they occur while urinating, after urinating, or before urinating. Then you would also have things like fever, nausea, vomiting, difficulty sleeping, trouble starting urination also, and sometimes you might even have a complete inability to urinate as it is. That is where we have the acute bacterial prostatitis. Moving on, we have the chronic bacterial prostatitis where these symptoms last for more than 3 months. They are not as severe. Acute is actually the more severe process in this condition. But in chronic, you have these symptoms, but they last for 3 or more months. This might occur after you've already treated acute, and maybe the previous treatment or of the acute bacterial prostatitis or the UTI was not properly carried out. That's when chronic would come into place. The symptoms, as I stated before, are similar to that of acute bacterial prostatitis. Lastly, men with asymptomatic inflammatory prostatitis don't have any symptoms. The healthcare provider will be the one to diagnose this condition when testing for other urinary tract infections. Now, you might say, okay, how will I notice this? Asymptomatic inflammatory prostatitis, it's a condition of exclusion. When you say the condition of exclusion, it means that all other things that might be affecting your urinary tract have been excluded, leaving only that as your diagnosis. Now, what are the complications of prostatitis? Now, you would see a bacteria, sepsis essentially, a bacterial infection in your bloodstream. You might have prostatic abscess, that is, you have pus filled cavity in your prostate. Sexual dysfunction, like erectile dysfunction, would also be known. And then inflammation of the reproductive organs near your prostate would also happen or occur. Now, what are the investigations that need to be done? The healthcare professional can use the following tests to diagnose a prostate problem: digital rectal examination, as well as prostate specific antigen. Other than PSA and DRE that I've spoken about before, another investigation that is usually carried out, that's also a gold standard for checking prostatitis, is called a biopsy. Now, this biopsy is a procedure where a small tissue of the prostate is taken for examination under the microscope. Now, your healthcare provider might also say, apart from these three investigations, there are other investigations that you might need to do so as to make an all-encompassing diagnosis, and they include things like urinalysis, which involves you urinating and then examining the content of your urine. Urodynamic test is just to look at different ways as which your bladder and your urethra store and release urine in intervals. A cystoscopy, where a tube-like instrument called a cystoscope is used to look into your urethra and bladder. And then we have a transurethral ultrasound scan, which shows the size of the prostate as well as different abnormalities that might be found in the prostate. An MRI or a CT scan can also be used to identify any abnormalities in your urinary tract. You may feel discomfort after doing these investigations, but your life usually returns to normal. Your activities are usually the same after you do these tests. Now, when it comes to treatment for prostatitis, it is essentially what is causing the inflammation of my prostate, and that is what you treat. So if it is bacteria, we use antibiotics. If it's inflammatory, we use anti-inflammatory medications. It's important for a healthcare provider to point out what exactly is causing this inflammation for you, and then put you on a treatment plan that would be best suited for that condition. Alternative treatments are also abound. When I say alternative, it means more like physical therapy, warm sit baths to help with the inflammation. You can also do Kegel exercises, relaxation exercises. You can stretch, do different exercises that would help your prostate in terms of making sure that things are working as fine as they need to work. When it comes to prevention of inflammation of prostate, there are a few strategies that can come about, maintaining a healthy diet, making sure that you stay active, you don't have a sedentary lifestyle. Drink as much water as possible. Drink plenty of water. Hydrate. Do regular checkups. Go to your healthcare provider to do regular checkups. The PSA is a very easy test to do. Your blood is just taken and examined to see the level of a prostate-specific antigen in your blood. Avoid smoking, as smoking is said to be linked with a lot of cancers. So stopping smoking would help you in the long run. Manage your stress. Stress, especially for men over 40, is usually a huge factor in affecting of the prostate health. So that is why you have to understand to manage your stress is very vital in prevention of affecting your prostate health. In conclusion, we've spoken about prostatitis at length. We've spoken about different things, how to manage it, the investigations to do, going to your healthcare provider, being very open with your health to them and what it means, how to look out for symptoms, what can cause it, things to do to prevent it progressing or to prevent it at all. We hope that this episode has been very informative for you. Thank you for tuning in again to another episode of Seco Direct. And if you have any questions that you want us to know, please go down to the comment section below and make sure to reach out to us. We'll be sure to answer any questions that you have on your mind, especially about this episode's topic, which is prostatitis. And If you have anything, make sure you subscribe and share with your family and friends, because these episodes and these videos seek out to make sure that we inform you to the best as we can on different conditions, not only about prostate health, different conditions like diabetes, hypertension, BPH, different conditions. Every condition is covered at Seco Direct. So please share this video. We'll see you next time. I remain your host, Dr. Tiwa, and thank you very much.